Gentleman from New York is recognized for 5 minutes.
Thank you, Mr. Chairman. I've been watching with some interest in my office as we've been trying to do the appropriation bill on the floor at the same time. I just want to try to set this up a little bit. You know, we have this tendency to believe that this debate is about health care. And to some degree it is, but what it's really about is how we pay for the health care we get. I mean, isn't it true, Mr. Larson, that if someone is struck by lightning and they're lying on the street, that ambulance will come and pick them up, that a doctor will try to resuscitate them. If they need surgery, they'll probably get it. But the question becomes how it is we pay for that care and how we ensure certain minimum standard of care. Is that right, Mr. Larson?
That's correct.
And are there not really three possibilities? One is the employer-based model, which is we pay premiums to an insurance company. They set the rules. They set the standards. We go to them. We pay them, and they pass the money along to the hospitals, to the doctors, to the ambulance driver, and then they take a certain amount of profit. The second model is the one where basically you don't have a private company passing along costs and apportioning those. A government agency kind of does that. For example, Medicare is like that. No government officer, Mr. Larson, is paid to be the doctor. It's just a matter of how we pay for that care. And then there's the third tranche of people which have no coverage whatsoever. They're the people that don't have any insurance whatsoever, and we hope and hope and hope they have money in their own pocket to pay for that care. But if they don't, isn't it true, Mr. Larson, that what winds up happening is we're stuck with some tough choices? We can say to the hospital doctor, tough. You've got to suck it up. And sometimes hospitals go out of business. We lost 17 hospitals, Mr. Gett, in New York just since the year 2000. Or we can say, you know, let's come up with some kind of a reimbursement program, unreimbursed care. Different states have different rules. The federal government has different rules. Or we can do this. We can say to the taxpayer, why don't you pay it? And we'll figure out later on how we do work that. And that's why states get stuck with such a large cost. Localities get stuck with large costs. When we had this discussion about how to come up with a system for dealing with those people that are uninsured, what did we do? We didn't go for the model that someone like I would have liked, which is, let's say, like Medicare for more Americans, eventually covering all Americans. We went with basically a free market model and said, let's try the employer-based system. Let's try to offer people both incentives, subsidies, and then if they don't do it, we're going to say to them, you know what, you can't pass your bills along to everyone else. You're going to have to pay a little extra if you're going to do that. Wasn't it, in fact, the system that we set up a reliance upon the market-based model, the free market model that says insurance companies, you go do this work? Wasn't that basically the path we followed here, Mr. Larson?
Yes.
And further, Mr. Larson, do not insurance companies, and they're not venal people, they're in a business, they're in a free market business, do they not make the most profits if they take in the highest amount of premiums and pay out the least amount in care? Don't they then make the most profit?
Yes.
And isn't the model today structured to incentivize them to do that? The problem is, Mr. Larson and Mr. Angoff, is that that model is not necessarily in the interests of our constituents or good care. I'll give you an example. What if they decide we don't want to cover preventative care? Or we don't want to cover people for the entire life of their illness. We just want to cover the first couple of days. They're going to make more money. Their stockholders are going to do well. That company is going to do well. But it's not necessarily in the best interest of the American people, whether you're in a Republican congressional district or a Democratic. Sometimes we want to say to them, you know what, we want to have some standards we want you to uphold. We don't want you to go out of business. We've socked it in on this process. We obviously want insurance companies to do well, to make a healthy profit. We want them to be around for years to come. But the question is, should we say to them, you know, maybe we should put basic requirements that if that guy's lying on the street, you can't look at him and say, oh, I don't think this guy's going to be a good deal, and have the insurance company keep driving by. No, of course not. We got to be able to make coverage. And you know what? They're doing remarkably well. I mean, let's face it. If you bought insurance company stock at the beginning of the recent downfall, you'd still be doing pretty well because people keep getting sick. People keep getting struck by lightning. People keep needing that care. They're doing okay. As a matter of fact, if you want to find the easiest let's say $300 billion or so you can take out, you can transfer in healthcare costs to better care and reduce taxes for people, you might want to look at the percentage of the healthcare budget that we put to insurance company profits. So the idea that somehow government is coming in and imposing some government solution, there's not a single government doctor that's been hired, a single government nurse, a single government operator of an x-ray machine. But that doesn't mean we should simply say you are unfettered by any regulatory force. You know, for all of the talk about let's have transferring of being able to buy insurance policies over state line, none of my Republican friends have said let's get rid of state insurance commissioners and state insurance regulations, because we acknowledge we need some basic regulations. Mr. Larson, is that basically in a broad form what your office has been spending part of its time doing?
Yes.
Thank you, and I await a second round, Mr. Chairman.
All right, all right. The gentleman has advocated strongly for Medicare as the solution, so he's made that argument all during our markups, and I think and I appreciate him coming down.